Hello everyone. Today I am here with a new topic, that is fibrinolytic and antifibrinolytic. And antifibrinolytics. So what this term indicate? Fibrinolytics. That means drug that can lysis the fibrin. Then next important term is, what is fibrin? The role of fibrin. What is the role of fibrin, or what is the fibrin? Fibrin helps us in blood coagulation process. Okay. Then next important term is, what is blood coagulation? Blood coagulation means a process by which our blood get coagulated when there is any rupture in any blood vessel. For suppose this is one of our blood vessels. Okay. If there is any rupture, then bleeding takes place. To prevent this bleeding, blood have to coagulate. Okay. So the bleeding, basically, due to this bleeding, there are several other like blood loss, hemorrhage type of condition generated. To prevent that, blood has to be coagulated. Okay, let us discuss about blood coagulation. Okay, so blood coagulation takes place basically in two pathways: intrinsic pathway and extrinsic pathway. Okay, so intrinsic pathway basically a in vitro pathway. That means basically such type of blood clotting basically seen when we draw blood and doing in vitro work. But the extrinsic pathway basically takes place in vivo. That means in living organism. So let us discuss how this blood coagulation takes place in intrinsic as well as extrinsic pathway. So in intrinsic pathway, first activated factor, when first we have to draw a figure, that is when there is a blood vessel damage. Due to damage, such type of pathway get activated. So let us discuss first about extrinsic pathway. Extrinsic pathway is, first is activated due activation of factor 12 to its activated from factor 12A. Then factor 12A activate factor 11 to factor 11A. Then this factor 11A activate factor 9 to 9A. Then this factor 9A activate factor 10. Then this factor A activate 10A. This is takes place in extrinsic pathway. Let us discuss about intrinsic pathway. The intrinsic pathway activation due to activation of tissue factor or factor 7 that converted to its active form factor 7A. Okay, then factor A directly activate factor 10A. So after activation of factor 10A, the major pathway activates, that is the factor 10A. What it is do is it convert prothrombin to thrombin, then thrombin convert fibrinogen to fibrin, okay. This fibrin is basically in soluble form, okay. Then this soluble form converted to fibrin insoluble form, and this insoluble form helps in blood coagulation process, okay. So next term is, if the blood coagulation process carried out, there will be a formation of thrombus that I discussed in the previous video. तो थ्रोम्बस फॉर्मेशन को प्रिवेंट करने के लिए हम क्या करें, हमने क्या करना पड़ेगा, ये जो ब्लड कोआगुलेशन वजह से जो क्लॉट फॉर्मेशन हो रहा है उसको डिजोल्व करना पड़ेगा. सो उसको डिजोल्व करने के लिए हमारे पास एक इंडोजेनियस मैकेनिज्म है, that mechanism is due to tissue plasminogen activator, due to tissue plasminogen activator, okay. What this tissue plasminogen activator do is, it activate plasminogen, okay. Then this plasminogen convert or plasminogen activate plasmin. So what this plasmin do is, plasmin act on fibrin and as well as plasmin can also act on fibrinogen, and due to this activation what the net result produces, degradation of the product, degradation of the product, okay. Understood or not? So again I am repeating, the due to the activation of due to the formation of fibrin, there will be a formation of clot, and you people know that due to the clotting of the blood there are several disease conditions arise that I have discussed in antiplatelet drug, and even I discussed in hypolipidemic drug. So due to that, to prevent that condition, we have a fibrinolytics or fibrinolytic class of the drug that dissolve fibrin. So how this drug basically act? This drug basically act by activating tissue plasminogen, okay, or plasminogen. So how these fibrinolytics drugs are act? These drugs are act by activating plasminogen. These are the fibrinolytics, okay. So what fibrinolytics are doing? Fibrinolytics are activate Fibrinolytics are activate tissue plasminogen activator that helps in the dissolve the fibrin, okay. So, and another important class of drug is antifibrinolytics, okay. Another important class of drug is antifibrinolytics. So antifibrinolytic drugs are what it is doing? It basically inhibit the plasminogen. So ये प्लाज्मिनोजेन को इनहिबिट करता है, मतलब जस्ट ऑपोजिट टू द फाइब्रिनोलाइटिक्स. फाइब्रिनोलाइटिक्स जो काम करता है उसका जस्ट ऑपोजिट काम करता है एंटीफाइब्रिनोलाइटिक. सो क्या क्या ड्रग्स आता है, कैसे एक्ट करता है, और उसके बारे में हम थोड़ा डिटेल में डिस्कस करेंगे. आई होप इतना. तो डैमेज ऑफ ब्लड वेसल, 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 देयर आर टू बेसिक पाथवे एक्टिवेटेड, दैट इज इंट्रिंसिक पाथवे एंड एक्सट्रिंसिक पाथवे. So this intrinsic pathway basically act in vitro condition, and the extrinsic path is activated basically in vivo or living organism condition. Okay, so how this pathway basically activated? This is activated by extrinsic pathway, basically activated due to activation of factor 7. Factor 7 converted to its active form, active to its active form, that is factor 7a. Then factor 7a activate factor 10a. Due to this activation, the subsequent activation takes place that leads to blood coagulation by formation of fibrin. Okay, so to dissolve this fibrin, we have a special mechanism, that is tissue plasminogen activate the plasminogen, and plasminogen converted and the plasminogen convert activate plasmin. This plasmin degrades the fibrin. Okay, now we will discuss about the drugs. So important class of drug is for fibrinolytics. Tissue plasminogen activator derivatives. So drugs are you can remember by mnemonics: US rat, U for urokinase, S for streptokinase, R for retelipase, A for altiplase, T for tenectaplase. You can remember by a mnemonic US rat. Okay, now we'll discuss each and every drug. So first drug is streptokinase. So streptokinase, important term about streptokinase is it is obtained from a bacteria, that is hemolytic streptococci. It is its source. Okay, and it is the first fibrinolytics that used clinically. Okay, so what it is basically do is it activates the tissue plasminogen molecule that ultimately activate the enzyme plasmin. Okay, the basic one of the important property point is it is non-specific. It is non-specific nature. Okay, so what this non-specific nature indicates? This non-specific nature indicates that it can activate streptokinase. That is, the streptokinase can activate both fibrin bound plasminogen and unbound plasminogen. Okay, this is the demerit because unbound fibrinogen having no role. Only the fibrin bound fibrinogen to be inhibited. Sorry, to be activated. Okay, and one of the important point in this about this streptokinase, it is antigenic, so it can causes hypersensitive reaction. Okay, then next drug is urokinase. So urokinase is basically isolated from the human this enzyme isolated from human urine. Okay, it is non-antigenic and directly acting. T half is around 10 to 20 minutes. Okay, the major side effect is basically fever. Okay, then next important drug is Altipage. Important point about this is it is a recombinant tissue plasminogen activator. First important point, it is a recombinant tissue plasminogen activator. It is very much important. Okay, second important point is it is specific in nature, that is it is activate the fibrin bound plasminogen. Okay, but it is having that is around 4 to 8 minutes. That's why it is given in IV infusion with heparin treatment. Okay, then next drug is Ritelplase. It is similar to Altiplase but having long T hub. Long T hub. Only difference. Okay. Then last drug is it is a genetically engineered substitution mutant of native tissue plasminogen activator. High specificity, long T hub. Okay, and another important term is only agent that can given as IV bolus. That means it is the only agent of this class of drug fibrinolytics that can given as a IV bolus. Okay. Okay. So next coming to its towards its uses. So its uses is very much important. So just focus. These uses are, as it is helps in preventing the thrombus formation. So first and topmost uses is acute myocardial infarction, acute MI. Second uses is deep vein thrombosis. Third one is pulmonary embolism. Fourth one can be given in stroke. Okay, or it can be given in peripheral arterial occlusion. Okay, then next important topic is that is antifibrinolytics. What it indicates? That is, it inhibit the activity of fibrinolytics. ये फाइब्रिनोलाइटिक एक्टिविटी इनहिबिट कर रहे हैं. सो अल्टीमेटली क्या करेंगे, ये क्या करते हैं, मतलब ये ब्लीड फाइब्रिनोलाइटिक्स क्या कर रहा था, थ्रोम्बस फॉर्मेशन को इनहिबिट कर रहा था. ओके, फाइब्रिनो एंटीफाइब्रिनोलाइटिक क्या करेगा, फाइब्रिनोलाइटिक एक्टिविटी को रिड्यूस करेगा. दैट मींस इट हेल्प्स इन ब्लड कोआगुलेशन. Okay, so its basic, so its important uses, you have to remember that it helps in hemophilic condition. That is, hemophilia is a, you know that it is a genetic disorder that is associated with bleeding. So to prevent this hemophilic bleeding, it acts as the adjunctive treatment of adjunctive treatment. It also helps in poisoning of fibrinolytics. So how this drugs basically acts? These drugs are act. How these drugs act? Inhibiting the plasmin activation. प्लाज्मिन एक्टिवेशन को इनहिबिट करके ये एक्ट करते हैं. ठीक है. सो व्हाट आर द ड्रग कम्स अंडर दिस क्लास? देयर इज टू बेसिक ड्रग that comes under this class is EACA, that is epsilon aminocaproic acid. Second one is tranexamic acid. Okay, so if we'll discuss about EACA, it is a lysine derivatives. and it is a synthetic antifibrinolytics. So it is basically used for the antidote for fibrinolytics poisoning. Antidote for fibrinolytic poisoning. Okay, it also used as this condition that I have told you previously, adjunctive treatment. Adjunctive treatment in hemophilic conditions. Okay, so coming towards its adverse effect, few common side effects are seen, that are hypotension, bradycardia, sometime myopathy. Okay, the next drug is tranexamic acid. It is 7 times more potent. Okay, 7 times more potent, and it is bind to the specific lysine binding site of the plasminogen. Okay, so what is its uses? Where the tranexamic acid uses? So tranexamic acid uses, first is poisoning of fibrinolytics, second point is peptic ulcer, peptic ulcer, then epistasis, that means nose bleeding. Fourth uses is prostatic surgery, prostatic surgery. Fifth one is bladder hemorrhage. Okay, these are the uses. So one point is, remember, you have to remember that it only given in the condition where bleeding is required. जहाँ पे bleeding का जरूरत है, वही सब condition में, वही सब place में these drugs can be used. Okay, we have completed the fibrinolytics and antifibrinolytics. Thank you.